always consult your doctor for treatment options. Some of the places in the world where people live the most, often without illnesses, even at old age, are located in rural areas with little access to healthcare. Likewise, there is a common trend with longevity and avoiding senescence or aging, living life without much stress and as close to nature as possible. It is therefore no surprise the ubiquity of prescription drugs in Western society, along with the deviation away from the body's natural health solution, has led to high mortality and illness rates. Of course, big investments from deep-pocket pharmaceutical companies must be paid back somehow, and employees from such entities often are able to land high positions in drug regulatory agencies. But it's not all bad. Remember something called the Black Plague, a bacterial infection which killed over 60% of Europe? Well, this could have been treated very easily with antibiotics. However, there are still underlying health problems which remain unanswered with many of the current prescription solutions, and patients thus must be increasingly more aware and involved in their treatment. The more permanent and preventive approaches to illnesses, such as a balanced lifestyle or holistic and natural healing, have seen a neglect which is alarming, and a good example of this is seen in heart and dietary illnesses, some of the most prevalent causes of human death. Someone who is obese, inactive, and has poor hygiene and dietary habits comes into a doctor's office with chest pain. The diagnosis is high blood pressure caused by inflammation and high cholesterol buildup, and a change in lifestyle is recommended, though a cocktail of 7 medications is prescribed anyway. The patient does not change their lifestyle, has life extended by a short while by very costly medications, after which a triple bypass is needed, and then the patient is admitted months later for heart attack defibrillation, during which the patient dies. Who profits here? Moreover, many medications which only treat symptoms may deactivate the body's own treatment strategies, as when used against high temperature fever, in which heat kills many different types of pathogens and stimulates the immune system, or inflammation, where damage or pathogens in the body are sequestered through swelling. Even so, there are exceptions, as with pregnant women who should take acetaminophen with fever to avoid birth defects. It comes down to what few people and even doctors are becoming unacquainted with: the mechanisms the body naturally uses to function properly, such as using antioxidants from vegetables to counter aging, damaging free radicals generated naturally by metabolism and immune system functioning, and leading to countless illnesses if not maintained properly, termed oxidative stress, or even natural habits like nose breathing and harder chewing on diet, which restructure more space in the airways and contribute to healthy tonsils, tooth alignment, blood oxygen levels, allergy levels, and brain functioning, and produce a beautiful face and smile. Although many are considered to be predisposed to certain medical conditions through heredity, this in many cases is only part of the issue. For example, a psychiatrist may prescribe dozens of different medications to treat everything from ADHD to bipolar disorder, but again, less attention is often given to true healing. Bipolar disorder, linked to heredity, has qualities identical to the ecstasy and despair exhibited naturally from such experiences as two people in love, and many other types of mental illnesses are no exception with regard to inaccurate diagnoses. In fact, it is common practice for medical professionals to diagnose an unknown illness with a generic term like fibromyalgia, unaware of the true origins. Fibromyalgia, a type of chronic, systematic pain, has no available medication, and many only see remission through meditation, stretching, and yoga. Likewise, in the book Epigenetics and Cancer, Dr. Fazlul Sarkar states the following regarding cancer treatment: one must take a holistic approach for developing drugs that could also target the tumor microenvironment and tumor dormancy that are regulated through epigenetics. To highlight this research is not meant to attack or defame doctors. Doctors who emphasize holistic health also exist. Salem Press Encyclopedia of Science states, osteopathic medicine is a branch of medicine that holds that the entire human being, not just the illness, should be treated. It emphasizes the relationship between the organs of the body and the musculoskeletal system. Osteopathic doctors use the body's self-healing abilities in their treatments." End quote. Thus, unless underlying chronic causes of illness are considered, prescription drugs are only a temporary solution to symptoms.